When low mood isn't just depression, a nurse's perspective on anemia, vitamin D, and doing the workup first. So something that I see very commonly, especially in women, and that's not talked about clearly enough, is this. A lot of women experience periods of low energy, low mood, brain fog, and that vague feeling of, I don't feel like myself. And often, these symptoms get lumped together and labeled as stress or burnout or depression, sometimes scarily quickly. Now, depression is real, mental health is real, and medication can be life-saving. But in healthcare, we're taught something important. Before assuming a psychiatric cause, you rule out physiological contributors, because the body and the brain are not separate departments that don't talk to each other. They are absolutely in constant communication, and sometimes aggressively so. Two of the most important things that come up in women are anemia and vitamin D deficiency. So let's start with anemia. This means that the body doesn't have enough healthy red blood cells to carry oxygen to tissues. Oxygen delivery is essential, especially for the brain, and the brain is very dramatic about oxygen. When oxygen delivery drops, the brain doesn't politely say, hey, we're running a little low, girl. It says, we're done, power saving mode. So what does that feel like? Persistent fatigue, even after sleeping, brain fog, difficulty concentrating, low motivation, emotional flatness or low mood, which clinically can look a lot like depression. Now let's add in vitamin D. Vitamin D gets talked about a lot, just like some supplement you grab at CVS, but clinically it functions more like a hormone. It plays a role in serotonin and dopamine pathways, immune system regulation, inflammation control, muscle strength, sleep quality. Low vitamin D has been associated with fatigue, depressive symptoms, increased pain sensitivity, and just generally feeling off. But here's something important that people don't realize. Even if you're outside in the sunshine and you're active and doing everything right to get vitamin D, it doesn't mean that your vitamin D status is optimal. Sun exposure and vitamin D utilization are not the same thing. Absorption and metabolism depend on factors like your gut health, your inflammation, your stress levels, and fat metabolism, and individual physiology. So yes, you can be outside every day and still be deficient and running in the Florida sunshine. Ask me how I know. I noticed this personally when I was feeling much lower energy and lower mood than expected, despite doing all of this. So instead of assuming something was wrong with me, I thought back to nursing school and I'm like, okay, what would I check first? After labs and working with a provider, addressing iron and vitamin D made a noticeable difference for me. Not instantly and not dramatically, but clearly enough to confirm that my body had been under-supported. Now, very important disclaimer because this matters. This is not medical advice, and I'm not recommending you go out and get supplements or injections. And I'm also not telling anybody to start or stop antidepressants. Everyone's physiology is so different, and labs plus a healthcare provider should guide decisions. So the point of it is to not take the antidepressants. The point is don't skip the workup, because when someone is chronically saying that they are exhausted and they can't focus and they feel low or they don't feel like themselves, good healthcare providers are going to say, okay, could this be anemia? Could this be vitamin D deficiency? Could inflammation or absorption issues be contributing? Could stress be depleting resources faster than they're being replaced? And for many women, especially high-functioning women, the body compensates for a long time until it can't. And when it finally taps out, the symptoms often get labeled as a mindset issue or you're just on your cycle kind of thing instead of a resource issue. One of the most helpful shifts for patients and for clinicians is moving away from self-judgment and toward clinical curiosity. So instead of saying, what's wrong with me, we ask, what might the body be missing right now? That question alone reduces stress, and stress reduction, of course, in itself improves outcomes. So yes, mental health matters. Yes, medication can be essential. And also, supporting the body can be a critical part of supporting the mind. And for a lot of women, asking the right medical questions first can prevent unnecessary suffering and lead to more effective treatment overall. If something feels off, you're not weak, you're not lazy, you're not failing, you may just need a more complete assessment. And one tip I can give you, which was really helpful for me because I don't generally go to the doctor, but I always go for my annual women's exam. And when I went last year for my annual exam, got to schedule that soon actually. I was like experiencing all these symptoms, and I was like, hey, can I please get a complete workup? Like, it's called CBC or a CMP, like metabolic panel or a complete blood count. Wow. So I had them do that, and that's how I found out that I was pretty anemic. Otherwise, that's not something that they would test for. But while you're there, maybe bring it up. Because I understand healthcare can be expensive, or if you just don't really have the time to be going to like a primary care provider or an endocrinologist. So definitely get yourself checked out. And I'm just here to help guide you through anything that is nervous system adjacent that you might be struggling with, and take away the shame. Because I'm also a big advocate of, let's maybe look at our lifestyle or physiological symptoms or diet even. Diet's so important in mental health, which that's a whole other topic. But be well, go get some sunshine. But if you're going to be out there running, please put on sunscreen. Please put on sunscreen and a hat if you have one. This has been another Medical Minute.